All right. I think we are live now. Cool. What's going on, everyone? Dr. Arash here, physical therapist with Prehab, and today is a special day. We're going to be talking about the neck pain, which is a very common issue, only second to low back pain in terms of years lived with disability, and then also talk about this exciting offer and campaign that we're running right now. But before I jump into it, let me know where you all are from. Show me, give me a city, give me a country. If you're not from the U.S., I'm curious to hear where you guys are located. I'll give you guys a minute. There's a little bit of a lag, and then in the meantime, I'll touch on this campaign that we have right now. So the app has a $50 off your first year promotion. And in addition to that, we will be giving out a free t-shirt and a mobility ball automatically with anyone that purchases the annual membership. So a very exciting offer that we have. I'll talk more about it throughout this live. Cool. Nice. Russia, Toronto, Gaithersburg. Nice. Florida. Very cool. And then for those of you that are here, if there's anyone else, I'm curious to hear where you guys are all from. And for those of you that are here, what are you most interested in learning about? I know I'm going to talk about the neck, but it's helpful to understand if there's other issues that you want me to cover or certain things within the neck. Feel free to throw it as a comment. And what I'll do is integrate some of that stuff into what I'm going to talk about regarding neck pain, because a lot of things are connected: the shoulder, the mid back, even the low back. There's a lot of things that can be stemming from one issue and manifest in pain in multiple areas. So that's why it's important to hear what you guys are most interested in learning about. And then if you are a professional and you're just looking to learn, also give me a comment with what profession you're in: PT, AT, trainer, chiro. How to have good posture. Okay, I'll definitely hit on posture. That's a big one. I know most patients that come in the clinic, the first thing they want to talk about is posture when they have neck pain. So we'll definitely hit on that. Yeah, anything else that you guys are interested in? And then what I'll do right after this is dive into neck pain, how to mitigate it from coming, how to get the pain to calm down after there has been some sort of irritation, and everything in between. So the first step with any, oh, nice. Linda, you're part of the shoulder prehab program. Want to make sure that that's the correct approach. How's it been going? How's the program feeling on your shoulder? That's awesome. Yeah, the shoulder program actually was the very first program that we created, maybe 2019, 2020. It was not even way before the app was a thing. So it's helped many people, that protocol that you're going through. Nice. Athletic trainer, AT from Michigan. Nice. Very cool. Triathlete, just here for fun. Have neck pain from swimming. I get that. I've had a few swimmers. Yeah, very important to have good T-spine and neck mobility. We'll get into that. Neck feels much better. That's awesome to hear. Want to make sure it stays that way. Exactly. It's interesting because neck pain, out of all the injuries, has one of the highest reoccurrence rate, meaning that once you have neck pain once, your probability of getting it again is very high, even more than a lot of other injuries, just by the nature of the neck. You kind of have to move it. You have to do things with it. But the issue is that a lot of people don't actually train their neck on a consistent basis. You see people work out their shoulders, even their low back, even their foot and ankle with some balance exercises, but they don't work a lot of the neck muscles. No wonder you see why there's such a high reoccurrence rate. So, okay, let's jump into it. This is great information. And as you guys have questions, please comment below. If you want me to dive a little deeper into a certain exercise or a certain point, I want to make sure that you are getting the maximum value that you can get through this live here. So actually, I'll start out with a story because I had really bad neck pain initially. And the reason for that was I was sitting in class and I always had my neck rotated towards one side, looking at the professor. And over maybe the span of 6 months, I noticed this really, really bad neck pain. Now, I did all the exercises and they would always help relieve the pain because the cause of the issue was still there. It always manifested itself, and I was constantly symptom managing. So, not until you find the actual root cause of the issue is where you will be able to make sure that this issue does not come about again. And I tried everything. I tried PT, chiro, AT, even injections. Like these things weren't helping, and I had to really think. It seems very obvious now, but this little slight rotation that I had in class for a long period of time ended up irritating it. So it's very important to try to think about any root cause of an issue, which will be ultimately how you solve the problem once and for all. Just wanted to let you guys know that piece. So with neck pain, I'm going to break it down into 5 different buckets of things to work on to make sure that this is for people looking to get out of pain or prevent neck pain from happening. So the first one will be actually not regarding the neck, it's regarding the mid-back, the thoracic spine. So the neck sits on the cervical spine up here, sits on your mid-back. That's the thoracic spine. And what happens is the mid-back oftentimes gets stiff. So if you think about it like I'm here, and I'm in this rounded position with my mid back, try rotating your neck. Do this with me. Try rotating your neck with a rounded mid back. See how much motion you get, both sides. Now try extending your mid back and then rotate. Or it's the same thing with flexing and extending. Like you just have less motion with your mid back rounded and without your mid back allowing for the neck to move. The mid back is the base of what the neck sits on top of. So making sure that you have good thoracic spine or mid-back mobility is very critical. We talked about this, the swimmer here. And if you don't have that thoracic spine rotation, you're not going to fully be able to set your neck up for success. And what happens is now your neck is going to have to work extra hard because I can't rotate my mid-back and let's say I'm trying to go to my left here, my neck is going to have to take up all that extra room that I need for rotating my neck. So it's going to stress the neck a lot more than it normally would if my mid-back doesn't have good mobility. And a very easy exercise that I'll show you guys is a seated windmill where you have one hand on the inside of your thigh like this, and then the other arm is reaching up towards the ceiling and rotating open. So this exercise will make sure that you get that thoracic spine extension and rotation at the same time. You can do the same thing with your hands on your head and just rotating one side and then rotating towards the other. And if you need some extra help, go against the wall and use your arm to push yourself open. Like if I have my chair here, I'm just going to push myself open. That way I can essentially passively, with some extra overpressure, help with getting that mid-back to open up. So this is a very important piece that a lot of people overlook with neck pain. I want to make sure you guys do address that problem. Kinsey here asks the question, how can you manage neck pain flare-ups if you sit all day? That's a great question. And this kind of goes back to the posture point that someone brought up earlier. Now, if you're sitting all day, you're in that rounded position, you can do the perfect exercises to keep the certain areas of the body open. For example, you're rounded, you do the reverse posturing movements to kind of open up, do some of the thoracic spine rotation exercises that I showed. However, I would recommend getting up and moving is probably the lowest hanging fruit. If you just take a lot of breaks and even find one of the exercises that I show you today, will be helpful. But just getting up and moving at least every hour, but I would recommend if you can for every 20 to 30 minutes to do some sort of movement, or even just get up and squeeze your shoulder blades back together, reverse posture for a minute, and then get back and do your thing. That would be a very helpful thing to your posture and to any neck or back issues. Susan here asks, 60-year-old now, rear-ended twice, severe neck pain, also a swimmer, hold my breath as long as I can, quit chiro a few years ago after 25 years of treatment. Wow. Also said goodbye to cortisone injections, now getting nerve pain block. very painful looking downward. Got it. Okay. So very painful looking downward. Now, a lot of times it's actually quite the opposite. The extension creates a bit of a pinching sensation in the neck. This is also not uncommon, but there's a lot of different things that this technically can be, and it's going to be hard to give you a specific movement. This is why I have the 5 different buckets that I'm going to go through, and I would make sure that you have something that's going to fill each bucket. If not, you can be missing a certain piece of it. I hope there's no radiating pain. I know you're getting some nerve blocks, so there could be the potential that you are getting some of that. And again, neck pain is an interesting one because people think neck pain is only pain in the neck. However, neck pain, especially at the upper neck, can create headaches. It can create it's called a cervicogenic headache. It can create dizziness. It can create that instability sensation. It can refer pain into the mid back. They've done nerve blocks where, facet blocks where within the joints, they've noticed that if they numb this area, the pain in the mid back gets better. It can also create numbness and tingling going down into your arm if the joints are compressed and pushing on that nerve. So anyways, let's jump into bucket number 2. So the first bucket was mid-back mobility. The second one is neck mobility. Now, I was going to show you guys a snag, which is a very good technique. I don't have, let me grab a towel real quick. This will be helpful. Okay, so you have a towel. What you're going to do is it's going to help with cervical spine rotation. So I'm going to have the towel like this around my neck, cross my arms, stabilize on one side, and then now the other side is going to get my neck to rotate. So this side is pulling down. The opposite side is going to get my neck to rotate. And think about bringing it across and up a little bit in this diagonal motion. So this will help with getting the joints of the neck to move a lot more smooth. There's going to be certain areas, and I'm going to go from lower to high and high to low. That way I can get all the different segments. That one's a really good one to get that cervical spine to move. If you don't have like a towel accessible, you can do this traction technique, which I really love. Place your fist under your chin. The other hand goes behind your head, and then you fulcrum over the fist to create this opening, this tractioning of the neck. And if you do that, you should feel a bit of relief and a bit of opening of a lot of those joints. It's a great one, especially if you're irritated and things aren't feeling too good. That's a very good symptom relief exercise to just calm things down. I'm going to go through some questions again. So that was the second bucket, neck mobility. And there are a lot of other techniques that you can use just from like an active range of motion. You can use some overpressure based on limitations that you have. But I really like this towel snag technique, especially when it comes to if you have neck pain, because you're not going to end range positions. You're working through comfortable ranges and allowing the towel to get your neck to move in ways that it usually wouldn't. Good day. Kevin says, Srinath says, is this permanently curable? If regular neck pain related to posture? Absolutely. It is definitely curable. This is why we have the app, because it's not even about making it feel better just in this moment. And there are many ways that you can do that. However, it's about making sure you have a good foundation set up, which is exactly why our neck and mid-back rehab program is 8 weeks long. We have this because it's progressive and you need to do many different movements and educate yourself on what to do and what not to do, how to sleep, how to make sure that you don't irritate it further, to allow yourself to not have this issue for a lifetime and to take care of it once and for all. So absolutely. And again, that app is we have the offer for July 4th. It's $50 off your first year. And then you automatically get a free t-shirt. I'm not wearing the prehab t-shirt, but you get a free t-shirt and our brand new mobility balls that we have, that you automatically get those two included for free. So if you do want access to the offer though, please comment July 4. If you comment July 4, what we'll do is follow up with you and just send you the link. And that way, perfect. There we go. July 4 sale. That way you can get access to that offer immediately. Just throw that comment below and we'll make sure to answer it. Thank you, Kinsey, for that. Okay, Jeff here. I'm an industrial AT. What exercises are best for chronic upper trap tightness due to repeated motion? Okay, this is a really good question, Jeff. This is a very common one. This upper trap stiffness right here, very uncomfortable, overused all the time. You look at studies, you see that even desk workers that have to use high cognitive demand have increased stiffness and increased tone of that tissue. Now, there are a couple different ways of approaching it. The first is you want to calm it down. You want to make sure that it feels better and you reduce a lot of that tonicity. Things like stretching it, you can do a stretch where if this is the right side for me, I'm sitting on my right hand and now I'm bringing the ear towards the opposite armpit. This will make sure that I stretch that trap. That's a good one just to open it up, stretch it out. I use some soft tissue techniques. You can kind of dig in that mobility ball that we have. We'll give you a tool to loosen it up a bit. And then following that up, you want to make sure that you have good scapular strength of the other muscles. What happens is the upper trap oftentimes overtakes the demand of the other tissues like the mid trap or the lower trap or even the serratus. So if you have good strength of the other muscles, the upper trap oftentimes won't have to work as hard. And if it doesn't have to work as hard, then you're not going to get all that extra stiffness up there. So we teach you how to progress through those movements in the neck and mid-back rehab program would be a good place for you to start. Susan, lots of radiating DDD, degenerative disc disease. You know, even though you're not going to be able to do much to the degenerative disc, you can help a lot with the symptoms that are associated with it. If you look at the statistics, almost everyone has, especially after a certain age, I can't remember the stats, but it's like 70 to 80% of middle age. I think it's like 90+% of individuals over 60 have DDD. And these findings don't associate with symptoms necessarily. So just realize that. Don't worry too much about the diagnosis itself, but realize there's a lot that you can do. And actually, one of my buckets is talking about nerve pain. So that's the last one that I'm going to talk about. Again, comment July 4. Susan, thanks for commenting here. Linda, I know you're already a member. Your question is there overlap between neck and mid, back, and shoulder? There is some overlap. Help me understand again, Linda, what your I see that you were doing the shoulder prehab program 4 weeks ago. But yeah, let me know what's going on with you real quick, and then I can try to help guide you a little bit better. And then, all right, I'm going to go to, I see a few more questions. Let me go to the next couple buckets. Let me just get through these, and then I'll start answering more questions. The third one. So the first one, seated mid-back mobility, neck mobility with the snags. Is 2. The third one will be deep neck flexor endurance. Now, this one's an area that people sometimes integrate with their core exercises. However, and actually out of the 5 buckets, this is the one that probably has the best evidence for helping people with neck pain. So make sure you have this within your program at some point. A very basic one is just a chin tuck. So all I'm doing is bringing the chin in, just holding that in. You can see that I'm stretching the upper neck as I do this, and I'm just going to hold that position. Now, you can do that seated. This is anti-gravity. Gravity is no longer working against me. Or I can do this laying flat, and you can see that as I go more and more down, there's going to be more gravity that challenges this motion. And eventually I'll go flat on the floor. I'll do a chin tuck, and then I'll lift my head off of the floor just a slight amount. So that's going to be a good challenge. And that's actually a test that I do with patients initially to make sure I understand what their baseline endurance looks like. And then you'll notice very quickly, people don't train this muscle. So if you train it a couple times a week for a couple weeks, it'll improve pretty quickly. It'll go from like 15 seconds up to 30 plus. And you want to have over 30 seconds of being able to hold that position of chin tucking lifting barely off of the floor and just holding that position. That's a really good one. And if you really want to challenge yourself further, hold it up and then do slight rotations. This will strengthen not just the front, but the sides as well. Okay. Bucket 4 is scapula stability. I didn't bring bands with me here, but ideally you have some sort of resistance band and you can do, I don't even technically need it. Like I can pretend like this is the band and I'm just spreading this apart, doing this banded pull apart, and I'm getting my scapula, those shoulder blades back there, to pull back. You'll notice that my entire arm gets pulled back because my scapula, my shoulder girdle is moving posterior. So I want to just pull that back and just hold with something like this, just a banded pull apart. I can just do a 30-second hold. I can do some reps here. I also can get on the floor and do what I really love to do is a prone T, arms out to the side, your head's down, and then you lift your entire upper body. Scapula pulls back, head comes off the floor, neck stays strong and stiff for that entire motion. And I like to hold that position. So you're uplifting and just holding that for 30 to 45 seconds. And then you'll notice that over time, that motion will get easier. You want to hold for as long as you feel like you can hold those. So if 30 to 45 seconds is too much, then take shorter breaks. Maybe you do 10 seconds and you do 5 to 10 different rounds of that 10-second hold. So that's scapula stability, very important one. Then the last one is for, I think someone here earlier talked about their DDD with radiating pain. This one is for the individuals that have radiating pain, meaning the pain is going down into the arm. Oftentimes it goes into these outer 2 fingers, but it can be the median or the radial nerve as well. This is more the ulnar nerve. So either way, a good stretch that you can do to help with keeping your nerves healthy looks something like this, where you have your hand out in front of you, and you can do this with me as well. Even if you don't have radiating pain, this is a good test to see side to side if there's any difference. Bring your arm out in front of you, bring your palm out, extend your wrist basically like this, wrist extended out to the side. And I'm just going to bring my arm out as far as I can. I feel a stretch right there, and I'm just going to come back. I'm just going to go back and forth. Now, this is more of a tensioner, if anything. If this is too much for you, bring your head towards that side. This will slacken the nerve from the top. So this will make it a little lighter. And what I would do is actually do a flossing technique if you're up for this, where there's a lot of moving parts with this, but as you're bringing your arm away, you're bringing your head towards that side. As you're bringing your arm back towards you, your neck moves away. So what you're doing is you're bringing the nerve towards one side and then moving it towards the other, and it's flossing through both of those. Wherever the limitation is, whether it's a disc or maybe it's coming more from like a TOS type presentation and it's stuck at the muscles of the neck. That way, it'll assure that you're moving it and bringing blood flow to that nerve wherever it's limited. So, I think it's pretty helpful to test and see if there's a difference side to side, and from there intervene by doing some type of nerve technique. So that was the fifth and final bucket. To recap, you got mid-back mobility, you got neck mobility, you have deep neck flexor strength, scapula stability, and then some type of nerve technique. And if you do all 5 of those, progressively load all 5 of those and make sure you challenge yourself further and further over time, you're going to set yourself up for success really of your entire upper body. I know we're talking about the neck and mid-back, but once you have these foundational pieces set, your shoulder health is going to be better. Even elbow and wrist and hand health is going to be better, because this is the base of all those other body parts. Okay. So hopefully that made sense. I know there are some questions I still want to answer, but just a reminder that the July 4th campaign is live right now for the next little bit. I think it's 6 more days until July 4th. So comment July 4 and we'll follow up with you on a link on how to get a free mobility ball, a free t-shirt, and $50 off your first year of the Prehab app. And the neck and mid-back program is what the Prehab app is on. So let's see here. Well, I forget exactly where I left off. Susan. Okay, Susan, you talked about the radiating pain. So hopefully that made sense with the nerve techniques. Is this session recorded? Yes, Susan, it is. If you're on our email list, you should be getting the follow-up email with this recording. So make sure that you sign up, ideally ASAP, probably before this is done, I think, to make sure that you get that. Can gabapentin cause numbness and tingling of the hands and toes? Yeah, gabapentin, Alicia, is a drug that it affects the nerves. So it can create, everyone responds a bit different. It's meant to actually quiet down the nerves and reduce activity. But some people have the opposite effect, and that's a possibility. Most people notice the opposite, that it reduces their tingling. Pascal here asks, are we going to talk about sleep positions? Yeah, Pascal, that's a great question. We actually did a YouTube video on this not too long ago. I would check that out. In short, between sleeping on your back, sleeping on your side, and sleeping on your stomach, I would prefer people sleep on their back as much as possible. It's not the most comfortable for people, and I get that. I personally don't love sleeping on my back either. I try to, but if you are on your side, at that point you can put a pillow in between your knees, put one underneath your shoulder. That'll keep things in more of an open pack neutral position. If you're on your stomach, that's the really challenging one because your neck is going to have to rotate fully towards one side just to breathe. I would put a pillow underneath your chest so that you can open up your body a bit and your neck doesn't have to rotate and stay so torqued. So those are the big takeaways there. Alicia, again, how to improve compression of the spinal cord due to a bulging disc of the spinal cord. Yeah, great question. So if there is a bulging disc that's hitting on the nerve, it sounds like you're talking about the cervical spine, the neck, which is what we're focused on today. I would do, so first, big thing with this is traction. I think that if you open it up with techniques like this, or I have an inversion table outside. I like that, and I kind of just open up my neck. The neck hammock is also a good tool that you can use. Outside of traction, I would make sure that you avoid the things that are aggravating it, which sounds like common sense, but you do have to kind of think through that piece a little bit and make sure that you reduce that. It took me, even someone that was going through PT school, a while to figure out that slight rotation is what created my neck pain over a long time horizon. And then the third piece is doing the exercises that we just talked about right now, making sure that the environment is set up for success, where all these tissues are strong and mobile, and the stress that you're going to have to place on that disc becomes less and less because everything else can handle all of the load. Susan, severe narrowing, lots of IMS. Are you talking about spasms? I'm not sure exactly what you're referring to here. Pascal here, I have a lot of tension in my neck. Do stretches help relieve tension? They do. I wasn't able to rotate my neck without pain for a year. Acupuncture helped a lot. That's great. I'm 22. I want to make sure I don't live. Okay. Yeah, totally get you, Pascal. That's a tough situation. I know that with tension, what makes it feel better is not always necessarily what you need long term to prevent that issue from happening. So if you are just stretching it, I think it can help with tension, but the tension is oftentimes a symptom of something else that's occurring. And if you don't fix that underlying issue, which usually is a lack of strength and stability somewhere, then the tension will continue to manifest time and time again. So that's why overall, addressing the neck and mid back the way that we're talking about it in a very comprehensive fashion is the best bet to make sure this issue doesn't come back again. So I would check out the neck and mid back rehab program if I were you. Linda, this is I think my neck pain is from carrying my heavy gym bag over one shoulder all the time. Yeah, Linda, I would recommend trying to rotate what side you're using to hold the gym bag. I know that's a common one. You want to try to make it as symmetrical as possible. If you only use one side with that, even if you don't have pain, you're developing one side a bit more over time than the other side. So just imagine going to the gym and doing, calf raises on one side only, not the other. Over time, it's going to create an asymmetry. And actually an asymmetry by itself, it can create issues down the line. So I would try to rotate. Susan, traps, OMG, right shoulder surgery 2 months ago. Need your help. Yeah, depending on what surgery it was. I mean, some surgeries like a rotator cuff repair, you want to be very conservative and not do too much the first little bit. But if it was more of like um, a debridement or removal of some tissue where there was no reattachment, you're not waiting for too much to heal, and you can move a lot quicker. Jonathan had a laminectomy this March 3 to March C3 to T1. Oh, wow. Okay. Mid back and neck pain down the arm still persists. Any suggestions? Yeah, laminectomy should open up the space to make it where the nerve pain obviously is less. If you're still noticing it, I would have to try to figure out what is causing that to that pain to manifest. I mean, usually it's C4, C5, but you don't have the C4, C5 joints with a laminectomy. Yeah, I'd have to analyze and do like a full evaluation to get a better understanding. But I would generally say that if you can find ways to do nerve techniques and do everything that we've talked about with this live mid back stability, neck mobility, these things will only help set you up for success, regardless of what the specific problem is. Cool. Some July 4 comments. Remember, comment July 4 if you want access um, to the app for $50 off and automatically get a free t-shirt, free prehab t-shirt, and a free prehab mobility ball. Both of those will be included with all signups. So make sure to get access to that. Comment July 4 and we'll send it out to you. We'll comment back. Okay, next question. Jeannie, I got a bad neck hump. I can't look down for too long. Any advice? Yeah, so if you're here, you're stuck in this position. What happens is you want to look from down up. Oftentimes, people are worried about how can I bring my neck back. When in reality, if you get the mid back to extend a little bit more, your neck is going to have to be in a better position. So if I'm here, neck hump, I'm here, and just by pulling myself up, I didn't do anything to my neck at all. My neck just followed suit and started to become in a much better aligned position where it doesn't have to be so extended. So I would focus a lot on the thoracic spine, the mid back. The more you can get that mid back to move with some of the things that we talked about earlier, I would also do some extension based exercises to get that thoracic spine to extend. This is coupled with scapular retraction. So if you can pull your shoulder blades back, this will set you up for success long term. Rihanna, how does thoracic outlet link into trap and neck pain? I felt it's in my neck and the nerves ran down my arm. However, I also had shoulder pain and was told I was tight in the thoracic and pecs. Wondering, is it mainly neck pain or referring pain from mid back? What causes TO, thoracic outlet? Good question. Okay. Thoracic outlet or thoracic outlet syndrome can be due to three things. There are three different areas that the nerves can be entrapped. One is in between the scalenes right here. The other is right above this rib right down here, which is I found to be slightly less common, but that's a possibility. And then the third is underneath this pec minor, right deep down here. So first you want to find where it's entrapped. It could be all three, but usually it's one or maybe two of those three places. it's not going to be, you can work on the neck all you want. You can work on the mid back all you want. It won't be fixed unless you actually target the areas where the nerve is entrapped. It's slightly different than just neck pain by itself because it's not from the cervical spine. It's from the muscles elsewhere. So finding out where it's entrapped is number one. And then once you find that out, maybe you have a little more stiffness here and you can start working through the tissue there. Then you start intervening on the tissues that you found to be the culprit, and that will help solve a lot of the problems. And usually it's the ulnar nerve down here that you'll start noticing gets more of that radiating pain. So yeah, hopefully that helps. I've actually got a lot of experience with TOS, surprisingly. Alicia, can compression of the cervical spinal cord cause upper back pain at the thoracic area? It could. Yeah, it definitely could. Compression of the cervical spinal cord can create a lot of issues. I mean, you want to try to avoid that from occurring. Pascal, could you do a quick recap of each of exercises with each bucket? Yeah, I'll do a quick recap, and with that, I'll be signing off. And make sure to comment July 4 if there's anyone else that's still in here that wants to get access to the amazing deal that we're running right now. So comment July 4, and I'm going to recap the 5 different buckets to bulletproof your neck once and for all. So the first one, mid-back mobility. You can do a thoracic spine rotation exercise in a seated position. You can also, if you want to get some overpressure, do this against the wall. I'm using a chair here just to get that mid-back to open up. You can do 2 rounds of 30 seconds or so for something like this. The next one is a neck mobility exercise. Grab a towel, wrap it around your neck, stabilizing it on one side, your arms are crossed, and then you're rotating up and across. So not just horizontal, but you're going diagonal. So you're going up and across, getting those segments to move. And I'm going to just continue to work through different segments. Be careful. There are arteries here. You don't want to just close down and squeeze this too tight together. That's not good. You want to keep it stable here and then pull the other arm up and across. I'm actually careful with giving that one because of that reason. The third one is deep neck flexor endurance, chin tucks, seated, work your way down into a supine position. Fourth is scapula stability. You can use a resistance band, grab it, pull your shoulder blades back, spread it apart. Same thing, 2 times 30 seconds. If you want to get on the floor, you can do a prone T we talked about with your head lifted off of the floor. This will also strengthen the back portion of your neck. The last one that we have is neurodynamics, improving nerve mobility and getting blood flow to the nerve. So bring your arm out in front of you and then pulling your hand out to the side, and you should feel a pull there. You can go back and forth. You can do a gliding technique where you bring your head towards it as you bring your arm away from you, and you're just going back and forth like that. Okay. Those are all the 5 buckets to bulletproof your shoulder or bulletproof your neck. But honestly, it can help with your shoulder pain as well. So try those out. Let us know what you think. If there are any follow-up questions, I think I answered everyone's questions here. But if there are follow-up questions, make sure to shoot us a DM, shoot us a comment. Check out the July 4th deal. I think everyone has commented that was interested. So we'll make sure to get back to everyone. And thank you all for tuning in. Until next time.